start my physical assessment. And it's important to note that as I'm going down, I'll be assessing his skin continuously because it covers the whole body. I'll be assessing for color, temperature, hair growth for perfusion, any tattoos, lesions, wounds, any other abnormalities that I should look at. But that's as I'm going through the whole motions. So I'm going to start with his head, looking at his hair, making sure it's healthy, looking for any signs of lice, palpating around for bumps, masses, any tenderness. Does any of this hurt?
No.
Okay. So after I've done that, I would move down to palpate his temporal pulses, making sure they're strong and equal bilaterally. And they are. Okay, then I'm going to move down and look at his eyes, making sure they're open, making sure they're not red, there's no discharge. I would check to make sure his pupils are equal, round, and reactive to light. So I'm just going to shine this light. Make sure his pupils react to the light and they're round and equal. Then I'm just going to ask you to follow my pen, okay? This is just checking the movement of his eyes, making sure it's symmetrical and there's no pain in movements. Okay, great job. Next I'm going to palpate his sinuses to make sure that there's no tenderness or swelling, so tell me if any of this hurts or is tender. Oh, don't wrinkle your forehead. Okay, you're patient. Okay, none of this hurts?
No.
Okay. So now that I've palpated his sinuses, I'm going to move down to his nose, and I'm just going to look and make sure it's midline, it's symmetrical. I would look up to make sure that there was no redness or discharge, and there's not, and there's no blockages or anything. Then I would move down to his lips, making sure they're symmetrical, pink, moist, and not too dry. Then I'm going to have you open your mouth. I'm going to look inside to make sure that the oral mucosa is pink and moist, which it is. I would also inspect his teeth to make sure they're clean and all of them are present. Can you open one more time? I'd also look at his throat to make sure that it's not too red and it's not swollen. Also his tongue, making sure that it's pink and moist as well. Then I would move on to his ears, making sure that there's no discharge, there's no swelling, there's no redness. Look down, make sure that they're clean and no signs of redness.
I would also perform a hearing test.
Okay. So now that I've assessed his face and head, I would move down to his neck. I'm just going to palpate for his lymph nodes to make sure that they're not swollen, because that would indicate that he's fighting an infection. And there's no swelling in the neck. I'm just going to make sure his trachea is midline. Can you move your head back like this? And it is. Can you, I'm going to check his movements of his neck. Can you nod your head yes? And shake your head no? Okay, good job. Then I'm going to palpate his carotid arteries, but only one side at a time, because we don't want to block the blood flow to the brain, to make sure that they're strong and equal bilaterally. I'm going to check for jugular vein distension, and there is none. His thyroid is invisible, so that's good as well. So now that I've looked at his neck, making sure there's no swelling, I'm going to move on to his arms. For extremities, you check color, motion, sensitivity, and temperature. For temperature, I would use the back of my hand and make sure that it's warm and not cold. The color is good and it's uniform throughout. For sensitivity, I'm going to use this Q-tip, and there's a soft side and a hard side. So I'm going to have you close your eyes and give me your hand. Give me your hand. And you tell me, this is the soft, this is the hard. So tell me what you feel. Is it soft or hard, okay?
Okay. Soft. Hard.
would do that on both sides to check for sensitivity. I'm also going to be checking hair growth. I see that there is the growth of hair, which means that he's well perfused. I would check his brachial pulses to make sure that they're strong and equal bilaterally. I would also check his radial pulses for the same thing. Okay, and can you give me your hands? I would check his capillary refill to make sure he's getting circulation to his hands on both sides. I would also inspect his nails to make sure that they look healthy, that they're well rounded and they're well perfused. I would check for the presence of any clubbing, which there isn't. Then I would assess his range of motion in his arms. So can you put your arms out like this? Okay, can you go like this? Thank you. And, okay, you can stop. Can you go like this? Okay, and can you put your arms straight out in front of you? I'm going to test his strength. So can you push down on my hands? Okay, very strong. Can you flip your hands over? Okay, so I'm going to push my hands down and I want you to resist, okay? Very strong. Okay. So now that I've assessed his arms, I also noticed that he does have a tattoo somewhere. A tattoo. So that's something you would want to notice to check for any infections or something's wrong with the tattoo. He doesn't have any other lesions or problems with his skin, and his movement is good as well as the circulation. So now that I'm done checking his upper extremities, I would go move on to his chest and his back. First I would look at his back, look at the spinal curvature. Usually his shirt wouldn't be on, but for the purposes of this video, his shirt's on. I'm looking at the spinal curvature, the skin again, to make sure there's no lesions or abnormalities. Can you take a deep breath for me? And I'm just checking the rise and fall of his chest with my hands to make sure that it's equal and symmetric. Then I would also do the same on the front side with the skin assessment. I'm also going to listen to his heart sounds. All 5 sites, which is, I'm going to do it over the shirt, which I wouldn't normally do, but for the purposes of the video, which is aortic, pulmonic, Herb's point, tricuspid, and mitral. And I'm just listening for normal S1 and S2 sounds, and they are normal. I would also take his apical pulse at this point and compare it to the pulse I got earlier. And it's 68, which is the same as the one I got earlier. I'm then going to listen to his lungs on the front and the back. I will listen to 6 fields on the front and 8 on the back. I'm also going to listen to the shirt, but I wouldn't usually, so can you take a deep breath? And again. Again. Have you turn around so you can see. Okay. Can you take a deep breath again? Last one. And I'm just checking anteriorly and posteriorly and making sure that they're equal on both sides, and they were. They're clear and equal. You can turn back around now. Okay, now that I've assessed his chest, and his back. I would move on to his abdominal region. I just forgot. I would assess skin turgor on his hands to make sure that he's well hydrated, and it bounces right back. So I would check that on both sides. So now okay, now that I've finished my top half of his body, the assessment, I would be assessing his abdomen. Again, it wouldn't be through the shirt, but I would be inspecting his skin for any abnormal lesions, tattoos, hair growth, anything same as the rest of his body. Then I would listen to his bowel sounds before I palpate. I would listen in all 4 quadrants. And if I didn't hear anything, I would have to listen for a full 5 minutes to say that there was absence of bowel sounds. But I am hearing normal octave sounds in all 4 quadrants. Okay. Then I would palpate for any abnormal masses or any tender spots or any distension. Is anything tender?
No.
Okay. So everything feels good. Then I would feel for his femoral pulses, making sure they're strong and equal bilaterally. Okay, great. You can sit back up now. Okay. Next I'm going to move down to his legs. Okay, next I'm going to perform his an assessment of his legs. I'm just going to be looking for color, motion, sensitivity, and temperature. I would feel with the back of my hand to make sure his skin is warm and not cold on both sides. I'm just going to be checking for his skin, make sure it's intact. There's no abnormal lesions. There's no, for scarring, for tattoos, for anything abnormal. Then I would check his pulses, so his popliteal pulse, which is behind his knee, on both sides, to make sure that they're strong and equal bilaterally. Same with his pedal pulses on both sides, and his posterior tibial pulse on both sides. Then I'm going to check for sensitivity the same way we did on your hands. So this is soft, and this is hard. So close your eyes.
Soft.
Okay.
Hard. Hard. Hard.
Okay. I would do that on both sides to check for sensitivity. Then I'm going to check his range of motion. So can you stick one leg out and flex your foot? Yeah, and circle your foot. That's a good idea. Wiggle your toes. Okay. Can you do the same with your other leg? Okay. Can you move one leg out? Okay. Put back in. The other leg. Okay. Can you stand up? Okay. Now I'm just checking his posture, making sure his stance is good. Can you take 2, 3, or 4 steps forward? Checking his gait and turn around and come back. And his gait is good. His balance is good. You can sit back down. So I've checked his color, motion, sensitivity, and temperature on his legs, and I have checked his range of motion and his posture, his gait, how he walks. So now that I'm done with that, I can check his reflexes. Ready? Okay. And he has reflexes on his legs. Now that I've done his leg assessment and checked for color, motion, sensitivity, his skin, his movement, and his perfusion, I can say that I'm pretty much finished with my head to toe assessment. I would just ask you if you have any other concerns that I should check out. Okay, so now I've finished my head to toe assessment, and I would go document my findings, and that's all. Thank you.